Hi guys, it's Dr. Jen Caudle and welcome back to the Be Your Own Doctor series. And today we're talking about how fibromyalgia is diagnosed. Now this is a question that I get all the time, so I wanted to make sure I put it as part of my fibromyalgia series. If you're not familiar with some of the other videos, please take a look in the comments. I've got links for you. So today's segment is about how we diagnose fibromyalgia. How are you going to make sure that you're getting a proper diagnosis? Well, let me tell you, honestly with this, the best asset that we as doctors and you as patients have is you. Now I'm going to explain why, but first make sure that you click the little subscribe button and hit the bell to make sure that you keep getting updates. Oh, and please watch the video to the end because I got lots of good stuff coming up for you. So, are you ready? Let's begin. And let's start by redefining fibromyalgia. Now, fibromyalgia is a chronic pain condition. People with fibro have pain typically all throughout their bodies, and it's got to last for at least 3 months or longer. But it's not just about the pain. People with fibro also have other symptoms, such as fatigue. They often wake up feeling unrefreshed in the morning, and they might have what we call cognitive issues, maybe memory problems or things like that. But patients with fibro also have other symptoms. They may have headaches or anxiety, depression, or irritable bowel syndrome. You name it, the list goes on. Think about some of those symptoms I just mentioned, right? Those symptoms could mimic the symptoms of other conditions. That's what makes fibromyalgia so tough to diagnose, is the symptoms overlap with other conditions such as things like lupus or hypothyroidism or polymyalgia rheumatica, other conditions as well. Remember, there is no lab test or radiology test like an X-ray that proves that people have fibromyalgia. So as physicians, we really have to rely on you, the patient, to tell us about your symptoms. That's so important. So now let's go through the criteria for the diagnosis of fibromyalgia, okay? There are two main components that your doctor is going to be looking at. The first thing is the widespread pain index. The second is the symptom severity score. So regarding the widespread pain index, remember that fibromyalgia is a condition that involves widespread pain throughout the body that tends to be chronic. So the first question we have is, and are going to have is, where is your pain? How many areas of your body do you have pain? And that's called the widespread pain index. The second thing is the symptom severity score. Now, the symptom severity score is actually broken up into two parts. The first part is your doctor's going to want to know about 3 particular symptoms. They're going to want to know, how bad is your fatigue? They're going to want to know, how often do you wake up feeling unrefreshed or have sleep problems? And they're also going to want to know, how often do you feel like you have memory or cognitive thinking problems? Now, the second part of the symptom severity score includes the other symptoms that I mentioned fibro patients have. That's things like irritable bowel syndrome, headaches, nausea, vomiting, heartburn, anxiety, depression. Your doctor's going to want to know how many of those symptoms you have as well. So now your doctor has a number of different pieces of information. They've got the widespread pain index, and then they're going to add both symptom severity scores. And those two numbers they're going to use to figure out if it's likely that you have fibromyalgia. Now remember, that's not the whole piece of the puzzle. Your doctor's got to do a physical exam. Remember also that your symptoms cannot be attributable to other conditions, right? So it can't be that they're caused by lupus or hypothyroidism or something else. So your doctor may in fact do blood tests or imaging tests to rule out other things. In addition, your symptoms have to last for at least 3 months or longer. One of the most important things you can do is to write down your symptoms when you have them. Sometimes it's hard to remember when we're feeling certain things and when. But keep a symptom diary, keep a checklist, keep track of your symptoms. Remember also that you can see a number of physicians to help with a diagnosis of fibromyalgia or other conditions. You can see your family doctor, such as myself. You can see your internal medicine doctor. You can see a rheumatologist. Sometimes neurologists diagnose these conditions as well as other specialists. Thank you so much for joining me today. Make sure that you check out the comments. I got plenty more fibromyalgia videos for you. And make sure you click the subscribe button and hit the little bell to make sure you keep getting updates.